What's
We
going
had
on?
we had heard varying reports of the field offices that we visited. Southern Oregon has an opioid crisis statewide, and there's opioid crisis, and they DHS is not tracking the data that they need to be able to determine that. If they were looking at the numbers coming in of babies, for instances, we talked to a judge down in the Southern Oregon area that said he had studied the numbers of children, babies coming in addicted to opioids, and had found it alarmingly increased. And so if you start studying the statistics of who's coming in and what makes up the characteristic of those children coming in, you could get some more answers, but DHS doesn't currently have that data.
And has that number, 11,000 per year, is that pretty steady, or is that increased
It's
year over year?
stayed pretty steady over the last couple years. It's been right at 11,000. So we haven't seen a huge spike of children coming into the foster care program, but we have seen a significant decline in foster homes.
That's really important to focus on. When you lose 55% of your experienced foster homes, and yet you still maintain the same number of kids, it's not an option that these kids be taken and given a place. They have to go somewhere, and so when you don't have the homes, that's when you end up in hotels with foster care workers who've worked all day, now having to be up all night, 2 foster care workers for an individual child that may be in this hotel, and then they can't be with their own families. I mean, it's a heart-wrenching situation when you hear a foster care worker a caseworker who was talking with the auditors and saying, I have a 4-year-old child who cries when I leave because she wants to see her mommy, and they can't give up on the kids that they serve, but they also have their own family. I was called several months ago personally by a woman, 26 years in the foster care system as a caseworker supervisor. She said, I'm retiring, not because I don't love my job or that I feel bad because I'm letting my caseworkers down by leaving, but I can't tolerate the stress anymore of having a requirement that I can't meet. It is beyond my capacity and my caseworkers' capacity to meet the needs of these kids without help.
How many